Hello, everybody, and thanks for joining us today for today's presentation. Before we get started, I just want to let you know that we now have a channel on YouTube for all of our webinars and discussions, since we won't be able to see any of you at events or trade shows in the near future. So don't forget to like this video, subscribe to our channel, and then you can click the bell icon on our channel to be notified when we publish new content. So today we'll be discussing Mips in 2021. This will be an overview of the proposed rule that came out last month. If you're unfamiliar with Marsden Advisors, my name is Randy Marsden. I'm an EHR consultant and founder of the consulting firm. I've been working in EHR since 2011 and worked on the meaningful use certification for an EHR. I launched my own consulting services in 2014. And we started our Mips Success Program in 2016. Besides the Mips Success Program, where we help practices meet the Mips requirements, we also work in data extraction and conversion. If you're switching between EHRs or practice management systems, we also help with EHR optimization. We also just released a software this year available online called ValView. It's an online tool that you can use to track and manage your Mips performance. It's available for free for all practices for 2020 reporting at mipsestimator.org. If you are a current Marsden Advisors customer, we're currently tracking your score in a different system, but we will be transitioning over to this program in 2021, and we'll be setting that up on your behalf. So our agenda for today's presentation, we'll be reviewing the top changes to the quality payment program, including each of the 4 categories. When we get to quality and we're discussing the measures there, they will be limited to the specialties that I have listed here, which are our core specialties. If you have any questions on any other changes to the quality measures, you can reach out to us directly, which I'll include information at the end of the presentation, or you can check the proposed rule yourself at qpp.cms.gov. We will also cover the rulemaking process and how to comment on this proposed rule, and then what to expect from us for 2021. So let's start with an overview of the Qpp program. This was established under the macro law. It ended the sustainable growth rate formula and combined several different programs, including meaningful use, PQRS, and the value-based modifier program into a single program. There's 2 ways to participate. Either if you are a typical fee-for-service provider, we'll be reporting under the Mips program. Otherwise, you may be part of an advanced APM, which could be an ACO or shared savings program, or other similar organization. Today's presentation will be focusing exclusively on the Mips program. So if you are reporting under an advanced APM, we refer you to the APM that you're part of for more information. So first of all, the categories, there were some changes in the weighting. So quality has decreased to 40% of your overall score, and that 5 points has been moved over to cost, which is now at 20% of your score. The promoting interoperability and improvement activity category weights have remained the same. Now, in terms of the program, you are scored on a scale of 0 to 100 points, and you need to get a certain score to avoid a penalty. On the left side, I have the 2020 thresholds there as a reference. Nothing has changed between those. On the right side, that's what is changing for 2021. So if you score below 50 points, you would be receiving a negative 9% payment adjustment in 2023. Once you go over 50, you'll gradually get a positive payment adjustment, same as last year, but this time when you the penalty will kick in after 50 points instead of 45 points. And then once you go over 85 points, just like last year, you're eligible for the $500 million pool to top performers. The biggest change from last year's proposed rule to this year's is that the Mips Value Pathways program, which is an alternative program to change the way that you're submitting and simplify things, has been pushed off till 2022 due to COVID-19. So we will be reporting the same way as you are in 2020 for 2021 as well. So we'll now start with the quality category. Pretty much everything here is remaining the same, except the weight went from 45% of your overall score down to 40%. The biggest change in the quality category, which is something we're not happy with, is how they're going to handle benchmarks. If you're unfamiliar with how benchmarks work, the data from 2 years prior to the performance period is used to determine the benchmark. A benchmark helps us understand, based on your performance rate, which is usually in a percentage format, what your score will be. So for example, down at the bottom, you'll see the cataract surgery, ECQM. If let's say you scored 95% on that measure, because you would fall within the decile 6 range of 94.12 to 95.69, you would earn 6 points. We use these benchmarks to track your score throughout the year so that you know exactly how well you're doing. But for 2019, which would be the performance period that they based the benchmarks on for 2021, they allowed practices to skip submission due to COVID-19. Therefore, they're concerned that the data isn't as reliable as it typically would be. So to solve that, they're proposing to switching to a live benchmark for 2021. If you're not familiar with a live benchmark, that's similar to how the cost category is scored, where we don't know what the benchmarks are throughout the reporting period, and we wouldn't know your actual performance score for this category until the submission actually happens at the end of the year, when it's too late to make any changes. So we are opposed to this rule change. We have filed a comment. We encourage you to do the same, and we'll provide instructions later in the presentation on how to do so. If that's the case, then we'll need to work on how you are submitting data. We might need to add some more measures to be safe, or we can use the historical benchmarks from 2019 to track it. But we hope that they do not move forward with this change for the final rule when that comes out later this year. There's been several measure changes. We've categorized them into 3 different sections here. So there are 2 new measures that are administrative, meaning they're coming from your claims data. Both of these measures are not relevant to any specialty we work in, so we don't expect any of our clients to get picked up in these measures. There's been 112 measures that have had changes, and we went through all of them. There are specific changes for each measure, but overall, the most common changes that we see is that any of the measures that have a medical reason exclusion are having the concepts that do not indicate a medical contraindication removed. Also, they are removing or adding telehealth encounters where appropriate per measure, and there's some other minor calculation changes. A full list of changes is available at the end in the appendix of the proposed rule. The reason why we're not going through them all individually is because that could very well change with the final rule, and none of the changes are that significant to be prepared for at this time. But you should definitely check those changes once the final rule comes out. There's also 14 measures that are proposed to be removed. The only ones that are relevant to our specialties is measure 337, which is psoriasis TB prevention. And then the 141 POAG plan of care measure was removed from claims-based reporting only, so you can still continue to report on that via a registry. Promoting interoperability. So all of the category-specific information here is the same. These are all of the changes highlighted in red. So the querying of the prescription drug monitoring program bonus measure in e-prescribing has been doubled in value from 5 points to 10 points. It remains to be optional, but it does add some extra points to the overall PI category. In the health information exchange category, they've renamed the receiving and incorporating health information measure to receiving and reconciling. The actual measure hasn't changed. They're just updating the name to match what's actually happening in the measure. They've also added a new measure to promoting interoperability in the health information exchange objective, which is the bidirectional exchange of health information. This isn't a measure that you need to do on top of the 2 existing measures. Instead, it's a measure you can choose to opt into, so you do not have to do the original 2 measures, and that would be worth 40 points. This measure, in a nutshell, listed here is it's a attestation measure, so you'll say yes or no to it, and it would replace those 2 other HIE measures if you choose to report. This measure is designed for practices that participate in a local or state or specialty-specific health information exchange program. If you are part of one, this may be a good measure to choose because you don't have to track every incoming and outgoing referral or CCDA like you have to currently. You would attest to these three statements, and you would want to check with your EHR vendor and your health information exchange vendor to make sure you are following all three of these. The next is improvement activities. So same requirements for the category as last year. There was only two modifications to improvement activities. The first activity, comprehensive eye exams. They've added some options for referring patients to vision rehab services. Overall, this measure is designed for primary care providers to refer their patients to ophthalmologists and optometrists for a complete eye exam. It's really not designed for ophthalmology or optometry unless you are providing no-cost exams to underserved patients, or you're providing literature on the topic of comprehensive eye exams and why they're important. The other activity that has a modification is the engagement of patients through implementation of improvements in the patient portal. They've added the ability to allow for caregivers to be included as users, and that specifically stating that the portal should support bidirectional information exchange. Simply having a portal doesn't make you eligible for this activity. We encourage you to review the full activity details and check with your patient portal or EHR provider to make sure that all of the requirements for this activity are available in the portal that you use. And finally, the cost category. Same requirements, except the weight of this category is now at 20% instead of 15. And the only changes to the measures, there's been no new measures added, luckily, so we're working with the same inventory as last year. They have updated existing measure specs to include telehealth encounters where applicable due to the influx of new telehealth encounter codes being used in Medicare for 2020 due to COVID-19. So the four categories make your overall score, but there is a complex patient bonus added to that score. That's based on your overall medical complexity and social risk for the patients that you saw in the performance period. Typically, that ranges on a scale from 0 to 5. That calculation will still remain the same, but they will be doubling that value. So you'll get up to 10 points on the complex patient score. If you're unfamiliar with what your complex patient bonus is, we refer you to check out the Quality Payment Program website. Once you log in and access your performance feedback, you can see what your complex patient score was from last year. Now, just wanted to touch on the rulemaking process. So everything we've discussed so far in this presentation is proposed at the time of this, the presentation that we're publishing today. They perform this every year to prepare for the upcoming calendar year of Mips. The public typically has 60 days to comment on the rule, which can be done at the federalregister.gov site. However, due to COVID-19, they've reduced this down to 30 days to get this final rule out as quickly as possible, also considering the fact that there were very minimal changes to the program from last year to this year. Comments are due on October 5th at 5 p.m. Eastern. And comments are really important. We've submitted a lot of comments in the past that have actually got led to changes in the program, so they do take them seriously, and they publish a response to every comment in the final rule when it comes out. Those are reviewed by CMS between now and when the final rule comes out, and any accepted changes are incorporated and published in the rule, which should come out no later than December. It may come out sooner due to the change in the deadline for the commenting process. We've submitted several comments based on what we've reviewed in the rule, the most important one being the benchmark change. On the left, this just lists the comment that we've sent to Medicare regarding this issue. If you'd like to submit any comments, will be a link in the email that we sent you today, as well as in the description below the YouTube video to submit a comment. Once you go to that site, you'll click submit a formal comment. You'll enter your comment and contact information. You can use our comment if you'd like as well, and then agree to the terms and submit the comment. The more people that submit comments on a particular topic leads to more likely of a chance of that being implemented. So just a final note on what we're doing at Marsden Advisors to help you in 2021. For our current customers, we are beginning preparing the setup and training process for 2021 right now, and we'll begin to update you on what needs to be set up for 2021 in December once the final rule is released. If you are an ophthalmologist on the AAO IRIS registry, we'll be helping you in that transition to Verana Health. If you receive any notifications from them, feel free to pass that along to your client success manager to get set up. If you have any questions on today's presentation, feel free to reach out to your client success manager as well. If you're not yet a customer, we definitely encourage you to check out the mipsestimator.org to start tracking your score today. It's completely free. We're accepting new customers for our 2020 and 2021 reporting programs at this time, and the contact information on how to get started is included in the email that you received, as well as in the description box below. And if you have any questions and you're not yet a customer, or you're not sure who your client success manager is, you can reach out to us at marsdenadvisors.com.